Okay, great. All right. Thanks, everybody. This is Julinna Oxley. I am here with the Jackson Family Center for Ethics and Values. I'm chair of the philosophy department, and we are here tonight or this afternoon continuing our panel discussion, which we're having on pandemic ethics this semester. So today we have a great lineup of speakers, and today is really our day to dig into the science of COVID and how it spread, and vaccines and the role that they play in maybe getting our way out of this pandemic or ending the pandemic. So today is our science day, and I'm very excited to say that I have two Jackson scholars. They work with me in the program for the Jackson Family Center for Ethics. And I'll just take a moment to introduce them, and then I'll introduce our panel speakers. So we have Rebecca Miles. She is a marine biology major at Coastal Carolina University. She's a junior and is very interested in ethical issues, women's and gender studies, and things like that. She's going to be asking some questions tonight. I'm also really excited to introduce Adanya Patel. Adanya is also a Jackson scholar. She is a sociology major and has a strong interest in social justice. And Adanya is also a junior and has great things coming up for her. So our two primary panelists tonight are my colleagues. I'll introduce Dr. Fredanna McGough. I've known Fredanna for a really long time, so forgot the name change. And so Fredanna is the chair of the Department of Health Sciences at Coastal Carolina University and directs the public health program. So that's the title of their department. And I also have the pleasure of announcing Dr. Paul Richardson, who is the chair of the chemistry and chemical science department?
It's just Department of Chemistry.
Department of Chemistry. Okay, excellent. And the two of them are really going to be giving us some insight into the chemical nature of vaccines and things like that, and also how public health works. So I'm really excited to have the conversation tonight, and I'm thankful to everybody for coming. So we'll just start our questions off. How do vaccines work? We know that we're having a lot of push for getting vaccinated. Can you tell us how vaccines work? And we've heard a lot of talk about herd immunity. And can you tell us about what these two things mean? And I'll just let either one of you start.
Well, I guess first I just want to say thank you for inviting us today. We've been doing a lot of conversations surrounding COVID, but we have not, well, together we've been doing a lot of, activities in this prevention effort, but we haven't actually had this opportunity to speak, to the public. So I'm really appreciative of this opportunity to do so. I would like to say that regarding vaccines, the main thing that we need to talk about is that it allows us to develop protective antibodies, okay, so that we are able to have our immune system recognize the virus and fight it off. And so it helps us to fight off future illnesses potentially by having these antibodies in our system, but it takes some time to build. When it comes to COVID-19 specifically, it takes about 2 weeks for the building to take place. So after, when we talk about the first dose and then we talk about the second dose, we see that they're about, 3 weeks apart. And then the second dose, we're able to see that there's a lot more immunity that a person can have, after a couple of weeks of having the virus or having the vaccine. When we talk about protecting the community as a whole, and so we're looking at population protection, that's what we talk about with herd immunity. And so it's like pretty much population immunity. We're looking at large proportions of a community that has been vaccinated. We want to make sure that we get to a point where it interrupts the spread, by having the majority of the population being, immune to this disease, so that it doesn't have the opportunity to spread from person to person. One of the things that we want to look at is the percentage of the population that can get the disease and the proportion of the population that actually is covered, and is immune. We want the immunity level to be higher than the the people who can get the condition and get the disease. When we look at overall, when we think about some diseases that are out there, for example, what would that number look like? Well, with measles, it's like 94, 95% of the population that has to be, vaccinated, that has to be immune for herd immunity to actually take place. For COVID, we don't exactly know what that number is. Initially, we were talking about 70%. Some people may talk about 85% of the population, but we don't exactly know what that critical number is. We don't know what the, what our herd immunity number is, but we try to get as many people as possible. So we're pushing beyond the 70%, with the hopes that that's going to be our herd immunity threshold.
Okay, great. Thank you. Dr. Richardson, you want to add on to that?
No, that's a pretty good answer.
Okay, great. All right. So one thing that we've heard a lot about is vaccines and then other kinds of treatments. So we've heard about monoclonal antibodies and then people taking ivermectin and things like that. What's going on with all the different medications and things that people are taking? Can you describe what monoclonal antibodies are, and are those a good thing? And then what about all the other medication that people might be taking to try to not get COVID?
All right, I'll field that question. First off, I think fundamentally we need to understand the difference between a vaccine and a monoclonal antibody. A vaccine is a preventative. Monoclonal is a treatment. So if you are infected, the vaccine is not going to be effective in helping you beat a current infection. A vaccine is something you have to take well in advance. In essence, it's, as Dr. McGough pointed out, it's basically introducing your immune system to the disease such that when it sees it again, it can elicit a much stronger and quicker response. So a monoclonal antibody treatment is one of the methods we're using right now to deal with serious infections. So if you have someone who's just a little bit sick, they're not going to get monoclonal antibody treatment. For those people who are truly in trouble on a ventilator, these are some of the efforts that are going to be done, because monoclonal antibodies do have some drawbacks that you have to pay attention to. As for some of these other drugs that we hear about, I cannot really specifically comment on them, but one of the good interesting things I did see in a news feed the other day, and I believe it was in the Midwest, was that a gunshot victim was denied access to a hospital because the hospital was flooded with people doing home remedies, which have caused them to get extremely sick, so they had to go to the ER. So I would seriously caution anyone about trying to do remedies that haven't been proven. I know when you're looking at a situation and it seems quite futile, that people will try just about anything they can to better their situation. But sometimes you need to understand that that attempt can actually lead you into a worse outcome than the actual disease itself.
Yeah. That seems right. I've been surprised about some of the things I've been hearing people taking, especially the dewormer and things like that. So I guess there's some sort of website that is giving out some unverified information. I think that is.
Well, the other problem with this is a lot of people are getting these drugs overseas.
Oh.
And I know of just a case this morning where an individual told me that they had a family member who was trying to get these drugs and they were getting it from India. And one of the things I always caution about is a lot of countries overseas don't have the same stringent safeguards when it comes to things that you have to consume. So you've got to be very careful, particularly about where you're getting these things and making sure that it's verified.
Yeah. That seems right. Okay. So one thing, we just had a question come in, and so I'll just go ahead and ask this one because it's a little bit related to what we're talking about right now with vaccination. So the question has to do with what's happening in Israel right now. So we have a large population that was vaccinated, and then they started having more spread. There were lots more positive cases. So they started suggesting having the booster shots, and it seems like we're not really clear on how to solve the problem. So we have a mixed messaging problem, which I think that's a result of not knowing, right? So do you want to say anything about that right now?
Yeah, basically the model that we are going to have to learn to live with is we are going to have to kind of think of this as the flu. And I'm not talking about the severity. I'm talking about how a scientific community approaches the flu. Every March, there's a group of individuals that meets. They go over the current data about the strains of flu that are circulating. They then choose the strains to develop a vaccine for. They produce it over the summer, and then you get it in the fall. Because RNA viruses mutate so rapidly, every 1 in 1,000 base pairs, basically, every generation of virus is different than the one previously. And it's not anything that is driven by the virus, it's a random process, such that new strains can develop rather quickly. So I can see in the future that we are going to have to be monitoring the changes to the virus and then probably coming up with a new vaccine every year to cover the majority of the strains that are going to be prevalent.
Okay, so thank you very much. That was really clear, but now I have a quick follow-up question. So you said something about an RNA virus.
Yes.
Okay, what is that? Well, what is an RNA virus different from some other kind of virus?
Okay, well, an RNA virus, so COVID-19 belongs to the Coronaviridae family, all right? And it is an RNA plus stranded virus, which basically means its genetic material is no different than a messenger RNA. Now, the difference fundamentally between all of these is DNA viruses tend to have a much lower rate of mutations. RNA viruses, quite frankly, are on the other end of the spectrum. They mutate very rapidly. So coronavirus has about 18,000 base pairs in it, give or take a couple hundred. So every generation, there is roughly 18 mutation differences from the parent strain. And every generation takes anywhere between 20 minutes to an hour or two before it destroys the cell and moves on to another cell. So very rapidly, you can get some mutations and differences. So does that help answer your question?
It does. It does. Can you give us an example of a DNA virus? Because we now know that COVID or coronavirus is an RNA virus. Can you give me an example of a DNA virus?
Yeah, of course. Now, another interesting difference between them is RNA viruses tend to be highly infectious, and they also get cleared quickly. DNA viruses tend to hold on to a human being for much greater periods, and a vast majority of them are passed through sexual contact.
Okay.
So, but there are some that aren't as much, but so that's some fundamental differences because they have some different strategies of how they're going to be successful in human beings.
Okay. All right. Got it. This is very good.
Julinna, one of the things that you also mentioned, and you were talking about, it's like, why are these breakthrough cases as well, that are happening, in addition to looking at viruses mutating and getting variants and things like that, we forget, sorry. Okay, my light, there we go. One of the things that we forget is that for about a year, we were through quarantine, we were doing all of these mitigating factors, we were wearing our masks, we were physically distancing and so on. And we have reduced, those public health measures quite considerably. And so there's a lot more exposure, to individuals and people. And so when we have more exposure and we increase the exposure and people are still, likely to get infected, we're able to actually infect more people. And so we're hoping that as we continue the vaccination processes, that it may actually help to interrupt that process, of jumping of the virus going between people, pretty much infecting people and being as contagious as it is right now, infecting others. So talking about different strains, we're talking about, variants and so on, but we're also reducing quite a bit of our public health practices that we had in place last year.
Yeah. So we have so many questions at this moment. I'm just going to ask one more question that's from the live stream, and then I'm going to have my students ask some questions. So I think the question is about Delta. Is an increase in the numbers, is it among the vaccinated, is it because Delta is just stronger, or is it merely an increase in the proportion of vaccinated individuals relative to unvaccinated people?
You want me to get this one?
Yeah, so then I'll follow up.
Yeah. So first off, Delta is a slight variant from the others that have been around, and it has been known, and it does cause disease in vaccinated people. But what almost most of the hospital records show is that those number of people who need extreme health care is very little. As a matter of fact, I just looked at Thailand's just produced numbers today. They have 11 people on ventilators, and of those 11, 10 of them are unvaccinated, 1 of them is vaccinated. So when we look at these things, we need to understand that the vaccination for the Delta strain significantly reduces severe effects. Now, if you look at the numbers in the hospital, instead of being 9% vaccinated are on the ventilator, those numbers down to 2% of the numbers overall that are needing an ICU bed. So it is affecting both people. And when you look at the number of cases, not the severity, you're going to see increases in those vaccinated and unvaccinated. But when you look at the people who need extreme medical care, it is significantly going to be those that are unvaccinated.
Okay, so just to make sure I understand what you're saying clearly, what the vaccine does is it does help you maybe not get it, but there's a lot of breakthrough cases. But we know that what the vaccine does is help you not get extremely ill.
For the Delta variant, that is correct.
The Delta
yes.
variant.
For the other variants, it is effective in making sure you don't even get sick.
Okay.
But for the Delta variant, it basically reduces significantly your chances of having to end up in a severe medical condition.
Okay. All right. Great. Thank you so much.
Fredanna?
Yeah, I was going to just say, just to add a bit of that, to that, we're looking at like 80 to 90% efficacy for, for most of the vaccines that we have just overall, right? But that reduces with the Delta variant, and the vaccines that we have. So if we're looking at, let's say 93% for Pfizer, like it's gone down to like 88%, efficacy for the Delta, variant. So there are reducing, effects that you see as with the new variant that we have existing. So people can still be protected, but it may not be as efficient, and as efficacious as perhaps it would have been with the primary, like with the Alpha variant.
There's one interesting thing people should understand about vaccines. If you look at average life expectancy over the last 125 years, you will see that because of antibiotics and vaccines, those numbers have more than doubled over the last 125 years. Particularly if you're looking at MMR, measles, mumps, and rubella, that vaccine itself has caused a very significant change in infant mortality in this country.
Yeah, that's great. That's good to know. I'm glad you mentioned other vaccines. All right, Adanya, do you want to ask the next question?
Yes, ma'am. So it seems like lately, a lot more younger people are getting sick and dying. So the question that I have is, what's going on with the age range of COVID? being transmitted in the people that are getting infected.
And I guess I'll try to answer some of that. And please, Paul, please just jump in at any time. One of the things that we're looking at, I would say, is behaviors, and that's just in general, right? We're seeing more people going back to their normal routines. It's been over a year, people are tired of, being at home and quarantining and not being social and so on, right? With the elder population, we're beginning to see that they continue to have these protective factors, still wearing masks. I'll take my father, for example, he does not go anywhere, without doubling up his masks and so on. But we tend to see that people who are older are much more cautious when it comes to this, with this virus. Younger people, not so much, right? There is a feeling of, that I'm going to be okay. Even if I get sick, I should be able to recover. I'm healthy, I'm strong, I should be fine. I'm not going to probably die from a debilitating illness or anything like that. So we see that people are going back to their routines, going back to what they've known and what they would like to do. And so they're exposed more. So with higher exposure, the risk is higher, and if we're not taking those other protective measures, the risk is high for those individuals as well. So there are elements that we don't, that we have to consider, and encouraging people to continue to still maintain their health behaviors, and their protective behaviors, even though it may seem like it's hampering or hindering, their social lives, perhaps, or the feeling of I'm not at risk, or even if I am at risk, I'm not at severe risk for illness or death or ventilation or any of those kinds of things. So it's like they'll take the chances. So that's part of it. And if you would, Dr. Richardson.
Well, I haven't seen any evidence to actually show that the Delta variant actually has anything physiologically advantageous over a young population. So I'm only speculating, and since I'm not an expert in human behavior, that it has to do with risk. My assumption would be we have gone for almost a year and a half, and we've seen a lot of young people not get sick. And I think now there is that sense of I'm invincible, doesn't really matter. And I think we are seeing a behavioral change, and that is catching up with people, and they are now getting sick. And then also would have to be, the rates of how many people are getting vaccinated or not. I know in young people, the rates of vaccination are significantly less than the age demographic that Fredanna and I share. So that is also going to factor into it.
Okay, good. Thank you. So it's not that the virus is just getting better at targeting younger people. It's just that the younger people have stopped being as careful as the older people.
Well, I can't say that with certainty. That's
for
speculation.
sure.
But I haven't seen anything scientific wise that actually says that. But like I said, we are speculating on that. That is not, we don't have scientific numbers on that. And that will become available later on when they do the behavioral studies and all the other things to try to better understand what's going on.
Great. Thank you. All right, Rebecca.
Okay, so we've talked a little about variants already, but I was just wondering, could you tell us how those happen?
Yeah, I'll field that question. As I mentioned before, this is an RNA virus. In order for its genome to be replicated, it has to use something called an RNA polymerase. It's a little molecule that copies the nucleic acids and makes another version of itself. In RNA, the error rate on these are roughly around 1 in 1,000. So it's actually 100 times worse than DNA polymerases. So this means that they're going to mutate randomly. One of the examples I give in my class is the difference in child rendering behaviors between a eukaryotic cell and a virus. Your mama loves you, and she spent a lot of time trying to help you and protecting you, because I'm guessing you're one of a few offspring she has. Well, virus mama doesn't care. Virus mama has 100 to 1,000, And all she cares about is one of her offspring surviving whatever challenges that are. So they have the strategy of having lots of mutations and changes to see if one of them will be more advantageous for the future. So these mutations are not, the virus is not actively trying to change to get over the vaccine. It is a natural random process that is a result of the behaviors of the molecules that are in the virus. So I think that's a clear thing. A lot of people think, oh, the virus is trying to change. The virus doesn't have that ability. It is the nature of the molecules it possesses to basically want to have lots of changes, in essence, to see which one might be more advantageous.
And they want to survive.
Yeah, it's a difference in how your overall survival pattern.
Okay, so this specific kind of virus, then the RNA virus, is going to mutate no matter what.
Yeah, a general rule of thumb when I teach virology and we talk about RNA viruses, and it's a little bit crude, but it's roughly the 2-week principle. In 2 weeks, either the virus will kill you or you will kill the virus. And this is the way most RNA viruses work. And I'd also like to point out some of the most deadly viruses on the planet are RNA viruses. Things like Ebola is an RNA virus. Rabies. These are all really nasty viruses, RNA viruses. The DNA viruses tend not to be lethal, but you tend to have them for the rest of your life. So some very different strategies based upon the actual molecules that exist in the virus.
Okay, this is so interesting. Fredanna, did you have anything to add to that?
Nope, I think Dr. Richardson has it perfectly down pat.
All right. So the flu. So you're claiming then that that COVID is going to be like the flu. The flu circulates in the population at all times. We just need to get a handle on the variants and which ones are circulating the most, so that we can make a vaccine for people to take, so that it'll prevent them from getting maybe some of them, but then hopefully it'll prevent them from getting extremely sick and needing to go to the hospital and get on a ventilator.
Yeah, that's the strategy that we are most likely going to move. I know about a year ago when we were talking about this, a lot of the virologists were trying to point this out to people that, you know, this is not something that's just going to go away. And they were showing and using flu as an example because they're very similar in how they do things. And you know, we're going to have to take a strategy like that to be more successful. Now, the reason why with the flu, everyone's going to say, well, you know, Dr. Richardson, the flu is not nearly as dangerous. And you're correct, except when you go all the way back to 1918, when you had something very novel pop up and the flu was significant. I mean, estimates range for over, millions of people dying. I think in the United States, that number is close to 20 million. And of course, we've never reached something like that yet. But, it will still have that same trend. It's going to be a problem. It is something we haven't seen before. So our immune system that we have got, which is a collection of all the viruses we have seen, isn't really prepared to handle this kind of infection. And it has been far more serious than we have seen with anything in my lifetime. And it's going to take a huge group effort to overcome it. Now, one of the things I'd like to point out is, how did we beat this in 1918? How did we get a handle on this? Because we didn't have the technologies that we do now. And the key was, as a society, we came together, we all came up with what we needed to do, and we all participated and helped that get done. And that same strategy is going to do that. Now, Dr. McCormick's going to tell you one of the most valuable tools we have when we combat diseases is not science, is actually education and knowledge, getting the information out there, how we can all contribute and help. My case in point, when you look at the HIV epidemic that struck in the 80s, it became one of the top 10 leading killers in the United States. but yet we never came up with a cure for that, but it is no longer near as dangerous. And the reason is because we came up with ways to educate the population of how it spread and how to deal with it. Yes, we do have some preventatives that allow people to live longer, but we don't have any way to cure it. And that's going to have to be the model we use here. Right now, we don't have drugs that can cure it, but we do know how we can prevent it. And if we all work together, we can beat this. But if we don't, then it's going to linger for long periods of time.
So can I just ask a quick follow-up question from that? And this is going to get a little bit into the public health aspect. Well, I have two questions that were related to the 1918 flu pandemic. So one of the things that I've heard is that they recently mapped the virus of the 1918 flu, and they found that it was the initial virus that killed a bunch of people, but the virus actually, the later variants were even more lethal, and that even more people died of the later variants. So I'm wondering if you could elaborate on that. Is that
actually, that sounds counterproductive. What I mean by is this: normally viruses that tend to be lethal at the get-go are accidents and mistakes. It is never in a virus's interest to kill you particularly quickly, because it prevents it from being passed on. And sometimes what happens, like in this case, is it's a virus that's actually not meant for human beings. Case in point, Ebola. It is not a human virus, but when it infects a human, its lethality rate is somewhere between 80 to 95%. It's quite high. Well, actually, now with modern medicine, those numbers are down to 50%. But the point is viruses tend to, as they propagate in a species and they are dangerous, they tend to become more infectious, but their lethality tends to decrease, because that is more advantageous for the spread of a virus than to be fatal or life-threatening.
okay? All right, that makes sense.
And I believe with the flu, a lot of the problems had to do with something called secondary infections, which means the flu gets you sick, but then a bacterial infection came in, and that was quite lethal. And remember, back then, we didn't have penicillin. Well, we didn't have those sort of treatments, and that's a modern thing that was developed around World War II.
Something very similar we're seeing, right, with even COVID-19, where it's like comorbidities are the primary issue of why people are actually getting sicker and dying from it, not necessarily from the virus itself, but not being able to respond effectively and efficiently to the virus.
Yeah, that sounds right. So let me just pick up on one more thing that Dr. Richardson mentioned with the 1918 the Spanish flu. I remember seeing pictures of they moved the schools to open air schools for young children and things like that. And people were doing lots of things outside, and they invented all kinds of ways to, pass things along to each other without breathing. So are these the kinds of measures that you guys are describing that's what it's going to take for us to really move forward in the pandemic or to make progress?
Well, one of the best ways to kill a virus is the sun. UV light does not react kindly to nucleic acids, and it tends to do a really good job of wiping out viruses. So this is why being outside is also better. Also, when you're outside, it's it's more open space, so you're less apt to leave any viral particles behind. Now, Fredanna, go ahead and do your public health stuff.
Well, so, moving forward, one of the things that we saw last year as well is, the reduction of the flu, person-to-person infections, and mainly because we were sanitizing our hands, even though we should do it anyway, but it seemed like it was much more in people's minds. It's like, before you leave the bathroom, wash your hands, please, 20 seconds at least, and, and wearing masks, and we were physically distancing, we're doing all of these things. And is that what we're going to have to do moving forward? Mask wearing is not a bad thing, to stop droplets from escaping and, infecting other individuals with the viruses laden with the droplets. So definitely want to make sure that there's some public health practices that we can continue doing without it being too inconveniencing for individuals.
We actually have evidence from campus that directly supports this. Last year, we developed our own COVID test that was developed by Michelle Barthet, the Department of Biology. And when we were randomly testing people, there was one location on campus that had the most positive people, and that was the dining hall. And we kept seeing people come through there having positive cases they didn't know about. But one interesting thing is there was never an outbreak associated with the dining hall, the Hicks dining hall. The reason being is they were wearing masks, they were socially distanced, and the crew that worked that dining hall worked their tail off, keeping everything clean. So we have direct evidence on campus at Coastal that shows these things work. They do keep an outbreak from happening. They do stop the prevalence of this virus. So like I said, I mean, we as coastal scientists, we've actually seen our own work help out.
So continue wiping those tables, and those surfaces, and the like, and we'll continue wearing our masks, and continue with sanitation practices because they do work.
Yeah, yeah. It's very interesting because it's, I think, you get set in your ways and you think life should be a certain way. And then now it's like, it's hard for people to change, I think. I mean, the adaptation of like going from not wearing a mask to wearing a mask, it's a lot of, it's a lot for people to get used to. I remember traveling to Asia once, and I think 10% of the population was wearing masks because they didn't feel good. And so they didn't want to transmit that to other people. And it was just a part of their culture, right? For people to wear masks when they didn't feel good. And it's just not a part of our culture. So making it a part of our culture, I think is our goal.
Mhm.
All right. Oh, sorry. Did we gonna add anything onto that?
Mhm.
Okay.
Okay.
All right. So I think we have another question. Let's see. Adanya, I think you have the next question.
Yeah. So we kind of touched base on the unvaccinated versus the vaccinated, but when there's people who say the vaccine doesn't make a difference, and so they kind of question like why bother getting it. What would be your response to that? Like, and more so kind of convincing them and explaining to them like the actual benefits of the vaccine?
I'm going to say they do. The vaccine does make a difference. We have the public health prevention practices, but if you have vaccines as well, it actually provides even more of a benefit to society and to our community. So yes, 100%, it does make a difference. And I would definitely say that people should really consider getting vaccinated, for a couple of things that actually Dr. Richardson had mentioned earlier, but it does protect against the infection, just in general, it will definitely provide you with a level of protection. We're not saying that, 100% of the people, 100 of the time, are going to be protected, but we do see that there is a high percentage of efficacy with the vaccine that allows us to say, yes, we highly recommend that this is something that people should do. And we see that, those who are protected, and even moving forward into like newer variants and the like, it can actually protect you from severe illness and from death. So if we're looking at of the idea of I may get infected, but how bad is it going to be? It will help protect individuals from that severity. Also, if you are vaccinated, the shedding of the virus is shorter, so that when you look at it that way, it means that your transmission is going to be actually lower, towards other people. So you're going to be transmitting less viral load, to others. And so that's a benefit to society as a whole. And so it makes people less likely to get sick from your infection. So even though you may be infected and you could transmit, it will actually reduce that period of time for you to be able to shed the virus. So it does help benefit society as a whole. So highly recommend it.
Okay.
I'm just going to go with what I said earlier. Look, if we really want to go through this, I think you have to look at yourself and you're going to ask, what can I do? There might be a time where maybe you don't think that getting that vaccine is going to protect you, but maybe it protects others around you. Perhaps some of your behaviors and some of the things you want to do. And, it comes down to, are you willing to help out? Do you want to be part of the answer to this problem, or do you want to help keep it going? It's pretty obvious. I got sick with COVID way before it happened. I was at an international conference, and a lady next to me from India was talking about something that was quite ravishing the country, and she was ill, and I got it early. And then, of course, when the time came, I still got the vaccine, and I still wear a mask. And it's not to protect me. I'm pretty certain that if I got COVID, I'm not going to get anything. But I'm doing it because I want to protect those people around me, and I want to protect my community, and I don't want to be part of the problem. I want to help, get through this.
I concur.
Yeah, so that's really useful to sort of clarify, because some people say like, well, you can spread COVID if you're vaccinated, but as you're saying, it's less, right? It's the lot smaller amount of time.
But the other thing is you're not going to be putting a burden on the healthcare system. So those people that need the emergency care can get it. Because one of the big problems is once the hospital gets overwhelmed, the lethality rate is going to go way up because we can't get people proper care. And the more we do that, the worse it is. When we start having to put people's in tents and we have to put them and we're not getting them the medical treatment they need, that's going to make the situation much, much worse.
Yeah, definitely. I really feel for all the doctors and nurses who've been working overtime throughout this pandemic. And I can't imagine, I would feel bad causing more work for them when they're already they're maybe not at the end of their ropes yet, but at some point you get compassion fatigue and things like that it's just harder to keep going and doing the work. I feel like
I spoke with the chief medical officer at Conway Hospital, and I asked him, what's the one thing we can do to help you out? And his answer was one word: vaccination.
It's that easy.
It helps relieve the stress that they're feeling. I mean, he basically pointed out the more people are vaccinated, the less stress he has on managing his facilities and making sure people get adequate treatment. Because as he was even pointing out at Conway Medical, those numbers of people, when I was talking to him, he didn't have any vaccinated people on a ventilator. No one was in ICU that was vaccinated based on his numbers.
Yeah. Yeah. Can you say a little bit about, I know that there's both vaccine hesitancy and then also anti-vaxxers. So some people say, oh, well, this one was developed really quickly, and how do we know it's okay? Can you say a little bit about the technology that enabled this vaccine to be created so quickly in that a year, which I think is the fastest historically that's ever happened?
Yes, I can. So this type of vaccine is one of the three main types that we have, and it's the mRNA vaccine. Now, it has some significant advantages, of which none of the material that we're putting in your body was ever part of a virus. When you look at the other two types, which is subunit vaccine and live attenuated, these are all derived from viruses that they've had to either, for live attenuated, go through a massive process to change the virus genetically, or in the subunit type, you're purifying the parts of the virus and then putting it in a human being. The mRNA is very similar to that, but we never had to purify anything. So there is no part of that that is going to cause a massive side effect in a human. So the mRNA enters into the body, goes into the cell, and it produces the viral proteins, the spike protein in particular, so the immune system can attack it. Within 12 to 36 hours, this whole process is going to be destroyed through natural recycling mechanisms that exist in every cell. Your cell's constantly breaking down products, using those nutrients to make new molecules. So that's why, of all the three types, it is the safest. Now, a lot of people talk about, how did we manage to do this so quickly? We've been working and developing messenger RNA vaccines for a long time. So it wasn't like this something special. It's just we were in a position, so when this happened, we could jump on those mRNA vaccines because the other two types would take significantly longer to develop. But with this particular third type, we're able to very quickly and efficiently produce an mRNA vaccine. And I'd like to point out the Pfizer vaccine now has full medical authority. It is no longer an emergency authorized use. It has gone through all of the proper safety protocols and is proved to be safe and effective.
And I just wanted to add that we kind of know that viral infections and pandemics are a thing that's going to happen in our world. We've seen it happen, and it'll probably continue to happen because of the nature of viruses. And so the development of of these vaccines have been in the works because people know that there are going to be viral infections that are going to affect our populations. And so so just to kind of remove some of that concern that folks may have, I think it's important to recognize that.
Yeah. So I apologize for my everything dinging on my computer. Someone was just sending me images of a protest that's happening in downtown Conway against presumably against masks and vaccines. And there's definitely a lot of people out there. This is right here, in Horry County. So I'm just curious, how do we reach people if there's a lot of misinformation out there? It seems like our communication channels have broken down a little bit. Is there anything practical that we can do to sort of address either misinformation or to try to get through to people who have a totally different worldview about science and vaccines and everything?
We're going to continue doing what we're doing, which is providing information, removing disinformation from, hopefully the media, the airwaves, social media, and making sure that misinformation is addressed, head on. It can be challenging. And unfortunately, it seems as though when people are pretty much up against life and death situations, they come to an understanding of, oh dear, maybe I should have considered, doing these prevention measures, or if a family member is dealing with it. We don't want it to get to that point, so, providing education, providing awareness, raising the awareness so that people know that it is a critical issue, hoping that people recognize that as a community, we all live together, we are all in this together. We'll continue to provide us the best information we possibly can. I think that's going to be really important to do.
I think it's important that, a lot of people go back and read about history and what has happened during these pandemics. I know I've spent a lot of time reading about this over the last year and a half. And you find that, the human nature and the differentnesses in all of us, we all look at things very different and unique way. And, these people who are concerned, they have reasons, and their only way these are going to be resolved is through proper dialogue and trust. What you have is a group of people that just don't trust the information they're hearing. And there are historical references to explain why we're not always believing the information we're getting. But as a scientist, my job is just to present the information I have at hand, and that's it. You all need to draw your conclusions. You need to see what we have to say. But there's nothing we can do to change someone's mind. They're going to have to want to change it themselves when they're ready.
And there's always the fear, right, of people feeling like things are getting shoved down, their throats, or being mandated. A lot of folks are fearful of mandates and saying that folks should not have influence, over personal decisions. And so there's a lot of that happening. I think when we come into an epidemic and a pandemic situation, we have to move away from the I and move towards the we, right? And because there is so much that we have to do as a community to be able to address this. And so it becomes a challenge when we start looking at things as my own personal individual, rights versus community or communal rights, because pandemics are very different beasts. If we're not all in it, together to be able to address this, then it has the potential of just completely running away from us. So I really want us to consider the we versus the I when we're talking about pandemics and global health epidemics.
Yeah, because the virus is potentially in everyone, right? So that's why we can't just try to assert our own rights or whatever, because we're still hosts, right, for the vaccine, for the virus. Yeah, it's very tricky. Rebecca, why don't you ask the next question? We got a good question here.
Okay, so Dr. Richardson, you touched on this a little bit earlier with HIV and how that we haven't found a cure, but we found better treatments. So is there a treatment or cure for COVID on the horizon, or are vaccines just our best hope?
Well, I'm going to be honest with you. The best hope isn't always the vaccine. It has to do with education and getting the information out there, how it's spread and how we can combat it. Vaccine is always a very powerful tool, but in every disease I have looked at, education and knowledge has been the far most important tool to initially control. As the second one, is there going to be a cure? Unfortunately, I haven't seen anything coming. A lot of the data that we have seen for testing drugs has not been very effective. And most of it been very circumstantial. In certain cases, it was effective, in others, it wasn't. This is not going to be like a bacterial infection. We're going to probably be able to develop an antibiotic and cure it. And there are some really important biochemical reasons why viruses are still the most hardest disease to fight. And the reason is they hide within our cells. A bacteria exists outside of the cells. So how do you go and find something that's hiding within you? It's like being able to drive through a neighborhood and tell if there's a crime going on inside a house. It's really hard to determine that. And it's going to be really hard for the immune system to figure that out. So these drugs are very difficult. And also, once you make one, how do you deliver it inside a cell? And that's another problem that you have to overcome. So I really don't think we need to put much confidence in some sort of miracle cure coming down the road. I just don't see it. And history has said that for most viruses, these really they don't exist. There's only been one virus that's ever been wiped off the planet. And it wasn't because we cured it. It was because we developed a vaccine for it. It was highly effective, and the virus can only affect human beings, and that was smallpox. It is the only virus that has been naturally removed. It does exist, but it only exists in a few labs in some of the developed nations.
So that's super interesting. So smallpox. So I'm going to feel real dumb saying this. So I've gotten vaccinated as a child. Did I also get a smallpox
I
vaccine?
highly doubt it.
So people got it. So how did smallpox get wiped out?
It took about 200 years.
Well, no, it didn't.
200 years?
No, I'm going to say from when it
did
was
not.
actually well, the vaccine was developed, right, by in the 18th century.
No, actually, that's a misnomer.
Edward Jenner.
The
Okay.
Chinese were the first to actually develop. Edward Jenner was the person who gets credit as the first Western scientist who developed it. And he didn't really develop a vaccine as much as he saw that the milkmaids didn't get smallpox because they got something called milkpox. And what happened then is they went around basically injecting themselves with milkpox, which was far less dangerous. It was still lethal, though, in very small amounts of numbers. And that's what started it. But really what put it over the top is when the WHO and the world leaders came together and put the financial resources to fight this as a world. And we eliminated it from a lot of the developed countries quickly. The last case of smallpox, I believe, was in 1979 in a Sudanese chef. Now, there have been cases after then, but they all have been due to laboratory exposure. But it was the last naturally occurring case. So it was the first time human beings came together and were very successful in eradicating what is the worst disease that ever afflicted mankind. Believe it or not, smallpox has killed more human beings than all the world through the history of mankind combined.
I will share this information. For example, I have been vaccinated because a lot of people in developing countries up until 1980, actually, or maybe even 82, were vaccinated against smallpox because it was still an issue, you know. But yes, official eradication, looking at, I would say 1980 as the official timeline is saying that it was eradicated. But it's fascinating that there are some people who still have the mark, you know, we call it mark late, because it shows up on our, you know, it's like a scar on our
It's
body.
a live attenuated virus that left a scar in the location it was injected. And it, you know, the vaccine was also not as kind as the COVID one. You got a little shot now and you get a sore arm. The smallpox vaccine it took you a little bit longer to get over that shot.
That is super interesting. So it sounds like, though, that what you're suggesting is that smallpox is a little bit different than COVID because we were able to eliminate smallpox, but it doesn't look like we're going to be able to eliminate COVID. We're going to be looking at sort of a lifetime of like booster shots or something like that with the flu. Am I understanding you correctly?
Yeah, the reason smallpox was effective is it only infected human beings. COVID can infect more than just humans.
Oh.
So this is going to be, I mean, if we're going to eradicate it, you know, theoretically, we would have to produce enough vaccines to basically vaccinate every human being and every organism it could infect within a probably 3 to 6 month period. And that's just unrealistic. This is why the flu is never really probably ever going to go away. The flu can infect birds, pigs, humans. There's no way we can get on top of all that. So we just have to do the best we can with figuring out what the variants are and coming up with a vaccine to help us.
Wow. Wow. So the dream of a COVID-free world or country is probably a myth. I don't know what the best way to describe it.
In time, like most things, this will not become as serious as it is now. As I mentioned before, most viruses will move to be more infectious, but less lethal and dangerous. And that is eventually where this is going to go, but it's going to take time. And it's going to take effort on our part while we deal with the part where it is very dangerous right now, particularly with a lot of people with underlying health issues. They are being targeted at a much higher significant rate of fatality than healthy individuals.
Right, right. Okay, wow, this is fascinating. So brace for several years of working hard.
I can't give you a timeline.
I understand. I know you can't. I'm just trying to get psychologically prepared. So, our last question, we're kind of wrapping up here at the end. We keep hearing about a lot of people just getting one shot and they don't go get their second one. Is that bad? Should you just, why do you need that second shot?
I'll say optimal immunity as best as you can would be the primary reason. As we mentioned before, you know, you get one shot, it gives you some immunity. You get 2 shots, it gives you more immunity. And that's just in basic layman terms. I know Dr. Richardson's going to mention some things a lot more scientific there. But generally speaking, it's just so that your immunity can be at the maximum that the vaccine will allow you to be. And Dr. Richardson, go
Yeah,
ahead.
so scientifically speaking, it kind of works like this. You get an initial immune response against the vaccine, but the problem is because of the nature of the vaccine, it's an mRNA, which is a derivative of a subunit vaccine. It doesn't provide us as a superior protection for the live attenuated, like getting the real virus itself. So you need that booster to help kind of jump your immune system. This is why a lot of people, when they notice the second shot, if they hadn't had COVID before, probably noticed it was a lot more, their arm was more sore, and it happened quicker because your immune system is ramping up much faster, which is exactly what you want. So when you feel that little bit of soreness in your arm, that's your immune system doing its job, doing what it's supposed to do, which is clearing up all that stuff. And I know they're proposing and doing another booster. And sometimes when you study these things, you have to understand it doesn't last forever. Some of these vaccines can last for a long time, particularly the live attenuated ones. But the subunit mRNA vaccines tend to have boosters so that you can keep this up. And also the reason we want them is as things change, we want to introduce the new strains that are circulating so that your body can still react and be effective.
Okay, got it. I think that makes sense. So one of the reasons then that like you get, for example, the measles, mumps, rubella vaccine when you're a baby, it's good for life because that's a different kind of virus.
Well, actually, you get the shot more than once, and now we're getting very technical because you have to. Because there is a time when you're between 2 and 4 years old, your immune system changes to its adult version. So you get some shots early to protect you while you're an infant, and then you need some later on to protect you when you've got your quote unquote adult. It's a lot more to it than that. And like I said, if you really want to get technical, I can start talking to you about how long it takes to get IgGs and IgG levels up and your initial response with your IgMs. And, there's a lot we can go into, but I don't really think the audience cares. But there's a lot of technical stuff. And basically it's, it takes some time for your immune system to ramp up, but the more you've been exposed to it, the faster it can do it. So one thing people think is, when you get a really good vaccine, when you get it and you never see the virus again, it's not that you were never infected. It's just that you were never able to have clinical symptoms. It's because your body was able to eliminate it so rapidly because you already had the memory B cells and T cells that are required to beat down an infection quickly. And this has to do with roughly the fact the first time you see an infection, it takes 2 weeks for your immune system to reach its peak. After that, you can start clearing things very effectively. But once you've seen something, then that time can get cut down to literally 12 hours. That's how long it takes before your immune system is ramped up so that it can attack the infection, well before the chance that the virus gets a clinical hold and causes symptoms.
This is fascinating. Thank you so much for all these explanations. Okay, so do either of you have any, I feel like we've gotten a lot of information tonight, and I think the big takeaway that I've gotten from the both of you is that what the doctors are wanting right now is for everyone to get vaccinated and for people to pull together and try to do what Fredanna's been talking about with the public health campaigns and to really do your part in society to try to prevent spreading the virus to other people by using social distancing, which now I at least understand how this is, that viruses are killed by sun and water and soap and things like that. So, okay. So is there anything else that either you would like to close with before we sign off?
I got one closing statement thing. As much as we've talked to you about a lot of the scientific, one of the things I have seen when I've studied the history of past diseases is how mankind tends to turn on itself and kind of get ugly with each other. And this has always been a disastrous consequence of any infection as people search to seek for answers and whatnot. And I think it's always important that we understand and respect each other and that we come together to do the best we can.
Yeah, that's great. Thank you.
Don't demonize the other.
Yeah, I think you're right. I think it's easy to get into very oppositional sort of relationships with each other, especially when we don't know each other, and you only see people, in passing. So I like your reminder that that we need to stay in conversation. So I'll just close by saying that is the point of the Jackson Family Center for Ethics and Values, to put all of the important topics of the day into conversation. And we're so grateful to have had our experts tonight, Dr. Paul Richardson and Dr. Fredanna McGough. So I'm going to also thank my students, Rebecca and Adanya, for being on. And thank you to everyone for tuning in and for asking questions. This has been great. I'm Julinna Oxley. So I'll just sign off and we'll say thanks, everybody. And I look forward to seeing you next time.
Thank you.
All right. Bye.